Thank you, Your Excellencies. I will talk about framing the conference. How did we come to this topic and what is expected in the next 3 days of the conference? May I start by saying that the conference, I think I have a pointer here. Yeah, it started a few years, maybe 20 years back, as Dr. Marian Tsao mentioned, as a small group of civil society organizations meeting on issues of health and care, basically, to becoming a large collaborative event with multiple stakeholders, like last conference in Thailand in 2014, or this one. And the conference themes, can you help me quickly move? Have moved from looking at older people, the perspective of older people as a vulnerable minority, the group in need of care, to the understanding that if you have 25–30% of the population over the age of 60, you have to see population aging as a central theme in the 21st century, central in planning, central in strategy development. And may I just highlight, sometimes economists, we tend to speak in a very arid and difficult terms, and since we have a wide mix of participants, sometimes the graphic representation of aging is useful. If you see, can you run, Caitlin? You see those graphs. On the one hand, on the vertical axis, you have the population aged over the age, under the age of 4. And on the horizontal, you have the population over the age of 60. We'll run it again, don't worry. But you have several countries, a sample of countries represented here. If you go back again to the same graph, you see between 1950 and 2050, the population until 1990, it's moving up and down with a proportions of population under the age of 40. But after 1990, all countries in different rhythms are moving towards a very rapid process of aging, and we're talking about Asian countries. Yes, so you can see Japan will be over 40% of the population over the age of 60. So one last time, Caitlin, you see the years there. So when we get to aside from Japan, after 1990, all countries in East Asia, South Asia, move consistently towards becoming aging societies. And the average age of populations, if you move ahead, the average age of populations, which starts at a very low, around 20 years of age, if we start moving from 1950 to 2050, you can see consistent growth of population. Again, Japan, for historical reasons, shoots ahead of all the rest of the region, but all countries are catching up and increasing the mean age of their population. Yes, the mean age of the population means that we are becoming mature societies, very mature societies, with different perspectives on life, on economy, on society in general, and that presents challenges and opportunities which are very different from the ones 20, 30 years ago. Now, there are 3 scenarios of aging in Asia, and as the minister well remarked, there are countries that are already very advanced in the process of aging. Countries like, it's not necessarily high income or middle income or low income countries, but countries that are aged, like Japan, Singapore, countries that are in rapid process of aging, already in process of aging, like China or Thailand, countries that are starting that very rapid process of aging, like Vietnam is in this year is in the process of very rapid aging, and countries which have a slower pace of aging. This presents opportunities of learning from different countries in Asia. We can learn from good practices, and we can learn also of bad practices. We can learn the positive effect of timely political and economic decisions and the cost of not taking those decisions. And we can mention some examples, right, Mr. Cho? So we can move ahead, and the question that we ask is, do we understand how population aging is shaping or reshaping our societies? And in the last years, we have had, especially in the last year, substantial number of studies, analysis, publications, research results that are shedding more light into the implications of aging, in particular the economic implications of aging. But there are still many questions that we don't know the answers. There are more questions than answers. We don't know many things, and we don't know what we don't know. In other words, we don't really know how the taxation implications will be, for example, in relation to aging. We don't know how the costs of care will evolve. We don't know what is the most appropriate system for long-term care, yet we are still experimenting in every single country of the region. There is no country that can say it has all the solutions. So we also have to work on developing policies, but policies on aging are a life process. You develop policies and you are constantly adapting those policies to the rapid process of aging. And may I say that with these questions in mind, we started the process of consultation with our network, with different members of different organizations on how could we better understand the economic implications of aging. In this process of preparation, we had a meeting in February with some experts on aging to shed a bit light on what we knew about aging, and you see some of them, most of them are here, I think. If we move, we understand now economic implications on aging on the basis of three key issues, three parameters. One is the macroeconomic performance, the shared growth and equity, and the fiscal sustainability. So if we try to unpack, to peel the understanding of economic of aging, we come to these three issues. The macroeconomic performance is how aging is going to affect economic performance. The ADB made some projections a few years back, that is going to affect negatively in terms of economic growth, the growth of the GDP by minus 1.5, -2% in different countries. But the assumptions that you were making on that are still being tested. So macroeconomic performance deals basically with the size of the workforce and the quality of that workforce. If we see the issues of shared growth and equity, Asia has been growing, I think, the fastest growing economic growth in the region, but also increased inequalities all over the region. And this is making this model of growth unsustainable if it doesn't have strong corrective measures. And that's something that can be brought about with the understanding of the economic implications of aging and how aging can interrelate with this more equitable societies. And finally, the fiscal sustainability, which is very simple, is how much money you get, the revenues in the country, the public expenditure, and the determinations of aging populations. So aging population, if it is seen as a receptor of public transfers solely, then it will create a considerable burden. But if aging populations are seen as a resource, as a potential that has skills, capacities, then obviously the analysis becomes much more complex. Let me see, for example, when we talk about these three parameters, making it simple, we take healthcare as an example. If you do not invest in designing an appropriate system of health system, if you don't understand that the functionality of population in different stages of life, but especially in old age, depends on the investments that you have made in the life course, then you'll have a very unhealthy workforce. Limited workforce will be reduced in size, reduced in quality, reduced in productivity. If you don't have the right design of the health systems or the right investment in the health systems, then the healthcare costs, the healthcare duties will increase the family, the household burdens significantly, as it is doing now in many countries. And in terms of fiscal imperatives, the rising cost of healthcare, a badly designed healthcare system, obviously has huge cares if you invest enormously in a hospitalized system. For example, you don't have the vision of prevention, promotion, self-care, and you start building a person-centered health system, then you will be seeing that the costs are increased. So investment produce revenues, and the revenues of investing in health are a healthy workforce, healthy population. And finally, I want to look at the conference structure for today. There are 3 presentations as foundation. They will go more in depth in each of these topics, and they are very distinguished and very senior presenters that we have here. The macroeconomic performance will be dealt with Mr. Dr. Achan Philip O'Keefe over there. The shared growth and equity, Mr. Jomo, I haven't seen Mr. Jomo. I think he's here. And the fiscal sustainability, which will be dealt with by Dr. Dong Hyun Park. Is Dong Hyun Park here? Yes, he's somewhere here. He's preparing his presentation. And he's from the Asia Development Bank. At the end of the day, we'll have a panel of experts of these presenters and Dr. Marian Tsao. This will be facilitated by Mr. Arun Maira from India, chair of the board of HelpAge. In the evening, there will be 2 side events, and you can look in the program book for them, one of them on China. For tomorrow, the conference structure has 4 streams, and there are 12 elective parallel sessions. I wish I could clone myself. That's what some people said, and be in different sessions. One on the workforce, one on health, one on income security in the households, and the last one on markets. You'll have to see the program. There is a session description, and then you can choose the elective you want to go. The first session on the right will be a session with the parliamentarians, that they will discuss with us the processes of policy making in their countries. So it will be a very, very useful topic for all of us to understand how laws and policies are made in relation to aging. In the workforce stream, very briefly, we will talk of how population aging affects the size and quality of workforce. And if I may take Vietnam as an example, what we call the support ratios. That's a questionable concept, yes? You support old age. Old age is also in many cases supporting younger generations. But if you see Vietnam in 2015, for every person retired, there are 10 persons between the age of 15 and 64. Yes? For every person who is 65 plus, there are 10 persons in what we could call working age. But again, those concepts are a bit questionable in terms of the boundaries. But if we move to 2050, we see that for every person who is over the age of 65, we have 2.7 persons in working age, or what we call working age, between 15 and 64. Now, whether we question the parameters of support or non-support, but the fact is that the proportion of population in working age is reducing drastically in many countries. China had last year a net reduction of 4.6 million, I think, of people in the workforce. No? Now, this stream will discuss what to do in that respect. Yes, what action can be taken to ameliorate the decrease? What can be done so that the economic performance is not really deeply affected? We have the health stream, and Professor Dr. John Baird is there present. The health stream is how will population aging affect health and functionality and our approach to health care. And if you see in this slide, the number of years people live in health after 60 varies substantially between countries. And the health systems have in a way, they are together with other sectors responsible of compressing morbidity, compressing the number of years lived in bad health, expanding the years lived in good health, in functional condition. And that is, again, the concept of investment versus cost. Yes? And finally, we go to the income stream. Not finally, but the income stream is how will population aging affect income security, not only for older people, but for their own households. And here we have to discuss inequities, how and the household dynamics and data, availability of data. In the last years, let me just mention that there has been some advances in the economic understanding of the determinants of income in old age and at different stages of life, and that is called the National Transfers Account. That's about 10 years, 10, 12 years it started. We have some of the key thinkers of that. Professor Sang-Hyuk Lee is here, and Dong-Hyun Park and Professor Ogawa. Let me explain very briefly what this means. When we talk about income security, we have this graph. It's a very easy to understand graphic representation. You have on the horizontal axis, you have the ages. On the vertical, you have hypothetical income, that's money. And you have the relation between income and consumption. The blue line is the consumption through life. So when you are below 15, 18 years old, you consume, but you don't have labor income. When you stop working, whether you're 60, 70, whatever, the retirement ages is something that has to be considered. When you also have no labor income, but you have consumption. So the analysis is, where does that gap, how is that the gap between consumption and income covered? And if we analyze that there is a stage in life where you have more income than consumption in general terms, yes, in general terms. So we are making large generalizations, but it's important to understand this concept. But in many countries, in many conditions, there is a large proportion of population who is living with barely, you see, with less income, so with an income curve that is close to the consumption line, and in many cases is below the consumption line, is near poverty or below poverty levels. So when you have high income, you can save for later life. But if you are barely having income to cover your subsistence level, you don't have the possibility of paying a pension. You don't have the possibility of contributing or saving assets to use in later life. So what can be done about that? How can economists and strategists and policymakers think about that? Then one first factor is we need in Asia to increase productivity, the capacity, the quality, and that depends on the quality of the workforce. The quality of the workforce depends on the functionality, depends on the education systems, depends on the health system. So everything is in a way interrelated. But if you increase the productivity, you are certainly increasing income and the possibility of saving for later life. But that's not the only source of income in later life. You have two other main chunks, which is family support, and which is, of course, you work in old age. So if you expand the barriers of work in old age, then you are also covering somehow that gap. Last night I was talking with Mr. Sumbun from Malaysia. He was telling me, I was telling him, well, asking him, what do you do? And he said, well, I'm retired. I said, but you're too young to be retired. He said, I've been 18 years retired. Where is Sumbun? There he is. I've been retired for 18 years. I retired when I was 58 years old. He's from Malaysia. Yes? So 18 years he has been with full capacity, skills, willingness to contribute. He joined the Cricket Association because he had nothing to do, you know. And societies with 25, 30, 35% of their population over the age of 60 in the future will not be able to afford missing that pool of skills, of resources, of knowledge, of capacity to work. So work in old age, expanding, being realistic about the boundaries of work in old age, but not everybody is in the formal retirement. There is, as the minister mentioned, there is a high proportion of population in informal sector, but that informal sector, or those agriculture and other sectors, have to be also provided with the capacity to perform with recognition to the work in old age and with the social security system, the health systems, and everything. The other way in which this gap in the later life can be covered is by providing social assistance. I think 82, 83 countries throughout the world have now social assistance programs, which is called social pensions, non-contributory pensions, to add to the mix of social pensions. That will be one session in the stream of income on the mix of pensions between contributory, non-contributory, and the experiences throughout the world in that respect. Finally, it's not only about income, it's also about expenditure. Health systems. You have countries where the expenditure in health is huge. It goes in the later years of life, represents an enormous drain to households, to families, to savings, to everyone. Depending on the design of the health systems, the quality of the care systems, those health and care systems can be also reduced. Those are some ideas about closing that gap between income, labor income, and consumption in old age. And that's also part of the implications, the economic implications of aging. And finally, the last one is the markets, the stream of markets. You see how population affect the consumption, the commerce, and the trade, the private sector. We can see that in the world there will be in 2050 2 billion people, 1.3 billion population in Asia, 1.3, and the disposable income in the hands of people over 50 plus in some countries is well over 70%. 70% of the disposable income is in the hands of people over the age of 50. That indeed is reshaping markets, is reshaping the way even the corporate, the private sector is looking at aging. And this session will also discuss the potential for establishing partnerships between corporate sector and governments and the civil society and international organizations in order to create a partnership that sees innovation, has innovation at the core, has well-being also at the core, no? Beyond just the profit-making approach. So they can be also partners in development. To finalize, and my apologies, Your Excellency, for the extent of this introduction, when we ask what are the aims of the conference, is it an academic event? Yes, but no. Yes, we get information from academics, research, studies, results, and all that. Is it an informational event? Yes and no. It's to inform ourselves of what is the state of aging. We keep asking, is it aimed at just capacity building, as the development world used to call everything is capacity building? Yes, but no. We are building our understanding. It is basically aimed at building consensus, building joint understanding of the social and economic adaptations needed. It would be pointless to have this gathering, all this effort hosting the conference by Molisa, or the effort of UNFPA and HelpAge and the network and everyone, if we just walked out of this room at the end of 3 days with the understanding, oh, I understand what is happening. No, I think we need to better understand what needs to be done in different areas in response to rapid population aging. Now, adaptation is not optional. Every country will have to adapt to the challenges of population aging. If you remember in the 20th century, when the large proportion of the pyramids of population were consolidated with a large proportion of children under the age of 14, every country went through a process of adaptation. They developed the education systems, the health systems, mother and child policies on education, vaccination, etc. We are now in a different shape where the population pyramid is not like that, is different. So societies have to adapt to this new challenge. And this is not an option, because the cost of not doing so is enormously higher than the investment that is required in order to adapt to this population. And the main responsibility is the governments, but it's not solely from governments. It is the responsibility of their own societies, of their communities, their families. It's a responsibility of international organizations, of academics. It's a responsibility of all. For once, we have one thing that we can say we all share, which is the adaptation to aging societies. And this adaptation is an investment in the future. If we do it, we'll have to do it in a collaborative manner. If we don't do it, future generations will pay the cost of delaying this necessary adaptation. So this is the purpose of the conference, is to adapt. Thank you very much. Thank you.